Hello, everyone. Thank you so much for being here. So my name is Kristen Sutherland, and you are joining us for a very special UNC Cancer Network event on melanoma called C.A.R.E Behind the Chair, Cancer Awareness Responsibility Education. And we want to point out before we get started, we will have a question and answer period at the end. We would love to hear from you, so as you're listening, please write down your questions. And there are a number of ways that you can get in touch with us. So on the first slide, you'll see our email address, so unccn@unc.edu. You can call or text 919-445-1000. And we also use something called Poll Everywhere. So at this moment, you would want to text UNCCN to 22333. That will invite you into the session, and then you'll be able to send us your questions, and we'll go over them at the end. So without further ado, let me give you some brief introductions for your presenters today, and then we'll get started. So our first presenter that you'll hear from is Andrea Ciccone-Snyder. She is a hairstylist, and she is also the face and voice and genius behind the Flow Beauty Project. So in addition to that, she is a salon owner. She's a third-generation hairstylist, and she's on a mission to promote whole life beauty in the salon and out. So you are going to love hearing her message, and she has some videos for you. Our next presenter will be Dr. Nancy Thomas. She is the Irene and Robert A. Briggeman Professor of Dermatology here at UNC, and also co-director of the Melanoma Program. And finally, you will hear from Dr. David Olilla. He is the James and Jesse Millis Distinguished Professor of Surgery in the Department of Surgery and the Division of Surgical Oncology. He's also a co-director of the UNC Melanoma Program and co-director of the UNC Press Program and a member of Lineberger Comprehensive Cancer Center. Thank you so much for being here. We are so excited. I am going to switch our slides to our very beginning ones, and then you will hear from Andrea first. So give me just a moment to get that up and running for you. And we will begin.
Hi, everybody. Thank you for being here today. I'm so excited to be a part of this program. There's nothing that makes me happier than to be in a room full of hairdressers. So thank you for taking the time out of your busy schedules and your days off to be here for this educational event. It's my mission to educate, empower, and help spread the word of whole beauty and wellness through the salon and beyond. So thank you again, and let's get started. We're going to look at some slides today that show us a little bit more about who we are in the salon and about the influence we have on our clientele. This is a mission statement that I've lived by since I started doing hair about 25 years ago, and it is from John Steinbeck. It is my considered opinion that the hairdresser is the most influential person in any community. When a woman goes to her hairdresser, something happens to them. They feel safe, they relax, the hairdresser knows what their skin is like under their makeup, he knows what their age is, and they don't have to keep up any kind of pretense. Women tell a hairdresser things they wouldn't dare confess to a priest, and they are open about matters they try to conceal from a doctor. When women place, and men place, their secret lives in the hands of the hairdresser can gain an authority few other men ever attain. I have heard hairdressers quoted with complete conviction on art, literature, politics, childcare, and morals. I tell you that a clever, thoughtful, ambitious hairdresser wields the power beyond the comprehension of most men, and that is John Steinbeck. So you are more powerful and influential to your clientele and community than you might have ever imagined. So now the question is, how do you plan on using that power? Well, of course, we choose to use our power for good, not evil. So as hairdressers, this opportunity and privilege to change the world for the better is an important one. One client, one haircut, one meaningful interaction at a time, because our clients really put their trust in us. And I know I take that seriously, and I hope that you do too. Do you want to help create a better world? Of course you do. And the answer is, how do you do that? You can change the world first by changing yourself for the better. And like Gandhi said, be the change you wish to see in the world. This is the mission of the Whole Beauty Project. First, to help ourselves gain confidence and trust in ourselves through different methods, coming to educational events like this one today, where we learn something new to spread to our clientele, self-development in different ways through spiritual, physical, psychological education. When we start on the path of self-discovery, the world opens up to us. So we can stand behind the chair with a sense of empowerment that we can be the healthiest version of ourselves possible. And then to use this perfect combination of stylist-client relationship in order to pass that message on to our clients. One client, one cut, one color at a time. So helping to empower yours and your client's beauty from the inside out. Health, wellness, beauty from the inside out. The best self is mirrored back to us with confidence. We get to pass this on to our clients. When we feel great standing behind the chair, we really want to empower and motivate our clients to be the healthiest versions of themselves they can be. Not just with hairstyle, not just with cutting, coloring, but with everything. It's a community effort. So again, thank you for being here and helping to get this important word about melanoma detection and education out there. We're going to move on now.
Hello, I'm Dr. Nancy Thomas, and I'll be going over some of the signs of skin cancer with you. I think hairdressers are fantastic partners for dermatologists because we're very visual people. When we look at the skin, it's almost an artistry of detection, and hairdressers are also very visual people, and so I think there's a lot of, I could see where hairdressers could find different things on the skin to be intriguing. And so I'm going to start with just mentioning that there are three types of skin cancers. And well, first I have to give an acknowledgement that some of the photos today come from the American Cancer Society gallery, and so you can also view them online at the gallery, and the diagnoses, if you wanted just to look back and see what they were. But the three main kinds of skin cancer are melanoma, which is the most serious type of skin cancer. It's the one where it needs to be detected when it's relatively small in order to be curable by surgery. And then the other kinds are basal cell skin cancer and squamous cell skin cancer. Basal cell is more of a local problem. It can become large and destructive, but it doesn't spread to other parts of the body like melanoma does. Squamous cell skin cancer is rather in between. It is a local problem initially, but if it's left long enough, it can also metastasize and lead to death. So we're going to start off with melanoma, and there is something called the ABCDs of melanoma. I think some of you may be aware of this. And the A stands for asymmetry, which is when you take a spot and you sort of bisect it one way or another, the two halves are different. And that's for melanoma, that happens frequently. The next is the border. The borders are irregular or jagged or blurry. The third criteria is color. A lot of times that can mean, it doesn't have to be separate colors, but it can be shades of brown, like dark brown and light brown. It can be black or red or white. And when you have two or more colors, then that's concerning. And then the diameter, a lot of melanomas are larger than 6 millimeters, so that is one of the criteria, but there are melanomas, they all start smaller than that, so it doesn't necessarily mean something is not a melanoma. And then the newest criteria that was added some year more recently was evolution, and that's a history of change in the area. And that actually is one of the most specific criterion, because a lot of things, there's a lot of benign growths that can look very similar to skin cancer, but some of these are static, like moles that have been on the body for years, but things that are growing and changing often are the more concerning areas. And so we'll start off with melanoma. As you can see, this is a lesion that's greater than 6 millimeters. It's got two colors. It's got irregular borders. And it's asymmetric on some level, at least from the edges and the color arrangement. So this has got most of the criteria for melanoma. And then you can see here, this one, the color is fairly even, but the borders are irregular and it's large. So it's not that every melanoma has to have every criteria, but our threshold often for biopsy is maybe two out of the criteria. And I'm going to run through, here's one where it started off relatively flat, and then it starts to get more of a nodule in it. So you can see that they can get rather large. This one looks more like an age spot, but it's a bit larger and a bit more irregular. So this is where you start to get into the overlap that some of these things can look like benign lesions. But I'm sure you see a lot of age spots, but if they look like they're kind of out of control, they're getting quite large, then you might want to find out if the person has had it checked out. Here's one on the cheek that's a little more subtle. There's not as much color to it. Some of these can even be pink, but this is very otherwise irregular and has the other criteria. And here's one where you can see the color change. You can see a little bit of pink. You can see the brown. The borders are a little irregular, not bad, but it has enough of the criteria, again, to warrant a biopsy. And then you can see some of them can be quite dark and become more raised. And some of them can be a little bit confusing because they can look like just a crusted area. They may not have that black or dark brown color that people associate with melanoma. So it can be really pretty difficult sometimes to be 100% sure. And then I'm putting a few pictures in here that because I know hairdressers are seeing people's ears, like behind their ears, where the patient may not be aware that something's present. So here's a melanoma on the back of someone's ear where they may not have been aware of it at all. And here's another one that's rather subtle where the person may not have been aware, and if nothing else, just pointing out that something is there can be helpful. And then here's some that are on the scalp, and some of these are our patients where I know they were not aware of it, which is why the lesions got to be so very large. And this patient has a good head of hair. It may be hard for the person to notice it. And here's another one where the person was unaware that it was there. And so you can see how some of these can get more advanced than something they might see that was on their face or on the back of their hand or somewhere where they were readily aware of the problem. And then this is a larger one. So they will continue to grow if they're not managed. So those are examples of melanoma, and I'm going to point out two things. One, that melanomas can come up as either a new spot or a changing spot. Some melanomas grow out of old moles. Others, they just come up as a new area. And so this is a man that has a new area on his cheek. I know it's very hard to see, but we here have baseline photos, and we can tell when something's new. So you can pick up things when they're very, very subtle. So sometimes I think it's worth asking the person, have you had this for many years? Because if they haven't, it's completely unchanged, then the chance of it being skin cancer is low, whereas if something is changing, then it's a higher chance. And so this was a melanoma, and then I have one more example where the patient had nothing on their forehead and then started to have a new area, and that, in fact, was also a melanoma. So just to kind of recap for melanoma, they're often, they grow, changing pigmented lesions are important to identify. The ABCDs help you. Evolution helps you, so it's really ABCDE. And I think the main thing is it's just to point things out if you see them, if you think the person's unaware of them. We're not necessarily, it takes a lot more training, of course, to know whether something is really a skin cancer or not, but I think you can be of great help to people just to make them self-aware, because self-awareness is one, they've shown that self-awareness is a criteria for survival from melanoma. If you're very self-aware of your skin and self-aware and you find things and you take them to your doctor early, you're more likely to survive if you do have melanoma. So now I'm going to, I know that today is mainly about melanoma, but I also would like to show you some other skin cancers because I think it's just important to know a little bit about them also. And the next one is basal cell skin cancer. It's a little bit different. It's more pearly, waxy, or scar-like. It's usually pink, but it can also be brown. And vessels are frequently present, and also you can see ulceration, which is where the outer layer of the skin is missing. And so this is an example of a basal cell in the face, and I think you can see the waxy look to it and the vessels. And so I think this one's a relatively obvious one. This is more of a scar-like one. These are a little bit trickier. They can look like eczema or just irritation in the skin. I think this is harder, but if you saw something, they have this very characteristic salmon pink color that makes them stand out to us. And so and then this one is behind the ear. Again, people don't really know what's behind their ear, and this one is a basal cell, and you can see a little bit of the ulceration where the outer, what we call the epidermis, is missing, and it's a little bit crusty. And so that's a sign of basal cell. And here's another one in the scalp, which of course is your area of expertise, and I think you can see that it's also crusted and becoming ulcerated. And so the third kind of skin cancer that I would like you to know about is squamous cell skin cancer. They're similar to basal cell, only they're rougher and a little more gritty and scaly. And they also are usually pink but can be pigmented, and ulceration can be present. And so we'll just go through a few of these. And this is a squamous cell skin cancer. You can see, you can probably appreciate that it's a little bit rougher on the surface. And here's one on the ear. Again, you may not know, even dermatologists can look at that and they can't be sure if it's a basal cell or a squamous cell. But it's got the characteristic pink color. It's usually these are growing. They're oftentimes, the one like this probably came up about 3 or 4 months ago, so they're relatively new. And so if the person didn't know about it, it would be important to point it out. And here's one, another one that is scaly, and you can detect it almost looks a little bit warty. Now, there are things called actinic keratoses that are precancerous. If a certain percentage of them, if left long enough, may go on to be squamous cell skin cancer. Some people quote a frequency of about 5% per year. And you'll probably see people with these little gritty areas on the back of their hands or a lot of times on their face. And so these are just precancerous for squamous cell skin cancer. Now, the really tricky part is that there's many, many benign things that look very much like melanoma or other skin cancers. And so I'll just show you a few of these just so you can appreciate that it would be very hard to be there and be making the diagnosis, but you could suggest, the main thing would be to make them self-aware, and also, if they ask you what should I do, to suggest that they, have it checked out. And so this is a normal mole. I think, most of these for adults have been there a while. When the moles do come up, they come to a certain size and they stop growing. They don't grow like, you saw some of those melanomas that just got bigger and bigger and were covering larger areas. They don't do that. Especially in adults, if you point something out and they say, oh, I've had that 5-10 years, then, chances are it's benign. But moles can also look different. They all don't look the same. There's junctional moles. They're little flat dark spots. And then there's compound moles. These are the ones that are slightly raised, that oftentimes have hairs growing out of them. These are benign moles. And then what you'll see a lot of is what we call dermal nevi, or dermal moles. Nevi is just another word for moles. And these are dome-shaped. They often are flesh-colored. As the mole matures with the person, it becomes lighter in color, it becomes fleshier, it almost becomes warty on the face. But oftentimes, these don't grow in diameter. They just get a little more raised. So someone might say, oh, they'll come to us and say it's changing, but as long as it's changing in an appropriate way and just getting fleshier, it's not a malignant change. And then this is a very tricky one, and I just throw it in there to show that you could have something that looks like a melanoma. Now, this has the dark color, but it's not. It's a benign mole. Some moles are very dark. They're called blue moles. But the history behind this would be typically that it's been there many years without any change. I'll ask the person. They're very discreet. The borders are tight. And typically the story is they've had it for 5 or 10 years without any change. And so, that's how now one this large we might biopsy anyway, but that's typically the story. And so again, it's just this issue that a lot of benign things can look concerning. And then I'll run through a few things that I'm sure you've seen lots and lots of, and these are liver spots or lentigos. They're on the back of the hand. They're from sun damage, and they're extremely common. And then this is the gamut of how they look, and you notice that some of them do look like melanoma. Now, they tend to have a little more angular borders. They don't blend into the skin quite the same way, but it's very tricky, and this is why I think, that the line has to be just making people aware, not necessarily trying to make a diagnosis. And then there's benign seborrheic keratoses, which are also extremely common and occur typically on the hairline. And these are a little bit wartier. They're almost stuck on the skin like little barnacles. You can pick them up and sort of lift them off the edge. But they're benign, and they come in many, many, many flavors. And as you can see, they can be flatter. They can look like some of them evolve from lentigos. And some people have many, many of them, and they have them in the scalp. So this is just an awareness of some of the benign mimickers. But I do think that it's worth making sure that that person is self-aware of what they have, and that if they have something that they're not aware that is new or changing, or that you have concern about yourself after you looked at some of these, that you make them aware of it. I think it's just helpful to them. Thank you.
All right, so we are actually going to watch some videos now to give you an idea of how you might want to check the hair and scalp of your clients. So Andrea has recorded some of these, so we'll show you the first one, and then she's going to talk to you about the process afterward.
Thanks for coming in today, Susie.
Sure.
I'm going to ask you, do you want to do a scalp check for melanoma today?
Yeah, can you do that? That would be great.
Yep, I can. And I'm also going to ask if you want your face and your neck to be looked at as well.
Yeah, so that would be wonderful.
Okay, great.
So Andrea, would you like to tell us a little bit about what they're seeing?
So, yep, when your client comes in, you want to get permission from them to check their head, scalp, face, neck, And right now I'm just checking the hairline. I'm making sure that I'm very thorough, going through, moving the hair around, checking behind the ear. As I was playing with the hair in preparation for this event, I started to see that by using the tool that we use every day, the blow dryer, we were able to get a really great visual of the scalp for prolonged periods of time, which is a little different than just combing the hair and moving it. So a blow dryer on medium to high setting, cool air, separating little by little so that you can see that you really can get a nice visual of all the parts of the scalp. I parted the hair so that I'm working with a small section, and we'll go ahead and do that on both sides and on the back as well. Pretty self-explanatory. Now, there are, of course, different types of hair. Some are going to be thicker than others. Some will be coarse. Some will be curly. So this is one method that you can use for hair that you think will work best. And of course, it's best to do this on clean and dry hair that has not already been styled or sprayed with gels or different things, etc. Oil would be harder. Oily scalp would be harder to see the scalp because the hair wouldn't part as freely. You want to try to do this at the beginning or the end of the service, but before you finish your client's hair. Takes about 3 to 5 minutes using the cool setting on the blow dryer. And if you want, you can go through with a brush as well, like a wide tooth vented brush, to lift and separate the hair as you're blow drying. Just depends on your preference. You'll get a hang of this technique after you try it a little bit. And like I said, it takes about 3 to 5 minutes. So you might want to, book that into your day with that client. We're all on tight schedules, but it's such an important thing to do for your client that you may want your receptionist to talk to clients on the phone when they're booking appointments or when they're in the salon after their appointment and booking a new appointment. Add on 3 to 5 minutes and ask and tell them that you have been educated and you are able to do a preliminary scalp check for clients. And hopefully everyone will say yes and will help to educate people on this important topic. So if you do find a spot or a lesion, as Dr. Thomas said, it's really important to encourage your client to see the doctor as soon as possible. Make a note, potentially, where you're making your chemical notes if you're coloring hair. Make a note if you spotted something, maybe even the size and shape of it. You could take a picture with the client's phone to let them see what you're spotting. Be sure to check behind the ear and the neck as far as the eye can see. That way, your next visit, you can check your notes and you can talk to your client and you can see, have they indeed seen their dermatologist? Have they followed up? And if not, start another conversation around it. And also keep a list of dermatologists in your area so that you can let your client walk out the door with their next hair appointment and a card for a dermatologist appointment. Thank you.
All right, thank you so much. And we will go on to Dr. Alila.
Thanks, Kristen. So I want to also thank you for taking time out. I realize that a lot of stylists have their off day on Monday, or barbers have their off day on Monday. So thank you very much for taking time out of your day today. So a couple of themes I want to get across, since I'm going to talk more about a little bit of why early detection is so important. I want to give a couple of thoughts as we go. So This is a cartoon that was presented to me from one of my patients that actually was a reformed addict of the sun. And for those of you that can't read, the message on the back of Cindy's back says future skin cancer victim. I realize also that some salons may choose to have different revenue streams, but I want to take this time to remind people that the tanning bed industry is one of the most poorly regulated industries that we have, and that tanning beds are actually a level 1 carcinogen. And I don't think I'm telling anyone something they don't know, but in October of 2015, tanning beds were banned in the state of North Carolina for minors. And so it's actually illegal for minors to have a tanning bed. We've done a lot of work here at UNC. Nancy Thomas has done work with actually a professor in the School of Journalism who's very interested in attitudes and behaviors of co-eds on college campuses about this. And this is actually a very important topic, but I just wanted to remind people that this is actually a big danger. And so if you're going to look for other revenue streams, the spray-on tans. There's lots of different products out there, but I would advocate get rid of the level 1 carcinogen and bring in different avenues for the spray-on tans. So with that as my public service announcement about that, I want to bring in to you something that these are both patients of mine, that they are both been seen repetitively, and they're 2 males, and both of them have delightful personalities. But on this one individual on the left-hand side, you may not appreciate it, but he's got 3 nodules going across his forehead. And so you can imagine that a barber or stylist that's been managing him, this would be an area that his stylist or his barber is going to be repetitively seeing. This is literally a gentleman I saw last week. And so I don't want you sitting in the chair at home or in your salon going, oh man, I missed the boat. Or, oh my gosh, I would have had that. What was their barber thinking about? I think it's really important to think of the theme that we're trying to get across today, and that you have access to a part of the body that your client may not easily have access to. And so if you can bring more self-awareness about a difficult to examine area with either Andrea's technique or with your own techniques, I think that's the take-home message for me, is if you can do that, you're benefiting your patient 100%. So if you've heard nothing else today, here is the theme I want to leave you with. The earlier a lesion is detected, the better the prognosis. It's shown time and time again, but if you're a numbers person, I'll show you some numbers in a second, but this is the theme. And that's why I think, and all 3 of us think, that it's really, really important for you to establish a rapport, or if you have a first-time customer, please don't be shy in saying, hey, I know we haven't met each other before, today's our first day, but you know what, there's something that bothers me. So I think you have a full license within your scope of practice to say to a new client or an established client, I think something's different. So for those of you that actually do better with numbers, this is still straight from the American the American Cancer Society. And the higher the bar, the better the prognosis. And so if you look at stage 1 melanoma, which is the most common and the most frequently diagnosed by far and away, you can see that this bar is almost at 100% for 5 years. It is a fact that early detection leads to an earlier stage and leads to a much better prognosis. So often that sometimes Nancy Thomas or I can handle this in the outpatient setting in the office with local anesthesia. And so early detection of lesions leads to a better prognosis and much less surgery. And as you can see, the orange bar is the 10-year survival. And there's barely even a dip from the 5-year to the 10-year survival. Now, there's some nuances about how you're a stage 1A versus a stage 1B, but you can see a slight decrement in the step-off. As we get more and more thicker melanomas, more and more later diagnosed melanomas, you can see how this prognosis continues to just drop. Okay? It's really most pronounced when we start to get into the patients that have lymph node metastases that we're worried about. And these are the patients with the 3B and the 3C, or for patients that have vital organ involvement. So I really want to give you a pictorial assessment that the most common melanomas are stage 1, stage 1A, they're picked up early, and they have an outstanding prognosis as compared to a delayed diagnosis that has lymph node or vital organ involvement. So why? Why do I think, and why do Nancy and Andrea think that you actually have it? Well, Andrea's shown you her technique. Well, this is actually my favorite part of the day, right? My favorite part of the day is right here, you know? And sometimes this is a disproportionate amount of time I spend at the stylist because, you know, this is for me the relaxation. Oh yeah, my stylist is right here. And so she actually has more time to look. And you can imagine that if this is me instead of this lady, you know, Andrea's got full license to look at the scalp line, the ears, while I'm relaxed in a different set of lights, okay? The platinum highlights you see in my hair are natural, so I don't do any of this. So, but again, you have multiple chances to be interacting with your client for whatever he or she needs. This sometimes for people, and I'm hoping that the blue shows up properly, this is a scary trend. You know, this is back when we were a farming nation, and look how low the bar is. This is for, if it shows up, this is 1 in 1,500 people would be diagnosed with a melanoma. You know, and as we evolved into this bronze is an okay society and outdoor lifestyle and don't worry about sun protection, you see the bars going up. But it's estimated that by the National Cancer Society and the American Cancer Society that there may be 1 in 55 North Americans diagnosed with a melanoma by the year 2025. That's only 10 years from now. So we've got things that need to be worked on. And so if we're having a tumor that's rising in incidence, we want to continue to detect it earlier. Nancy's gone through examples with you. I wanted to show you one other one that, again, may be part of your business model. Is you may have someone that does nails in your office. And so examining the nail beds, looking for pigmentation, and understanding what's going on with the nail bed is another area where a stylist or a salon may have access to a part, and yes, you can get melanoma there. This actually also is a very common place for African Americans to get melanoma. So for those of you that may have a very diverse patient population, this is another area that you need to examine. So I think I've showed you that I believe that stylists can play a vital role in early detection, and the early detection clearly leads to better prognosis. If you see a changing or suspicious lesion, and again, if the suspicious lesion is on a first-time client, I think you're well within your scope to mention this. Make sure they see a healthcare provider, whether that's they get to a primary care provider who has a relationship, or whether they get into a dermatologist, someone needs to make that diagnosis. So that's the early detection message, but there's one other part, and I just want to briefly touch on this, is because the last 5 years in melanoma have been very exciting for the people with advanced disease. So I trained in the mid-90s, between 1995 and 1998 was when I did my surgical oncology fellowship. And if we're really honest, from that time frame until 2010, we really didn't have very good agents to help treat the melanoma beyond surgical resection. And as you can see, response rates of 3 to 5%, and I don't want you to worry about the names of the compounds, 7 to 8%. Another drug that didn't have any overall survival advantage. It was really kind of a depressing time. But fast forward to 2011 and on, we have started to have drug after drug approved by the FDA that actually has survival advantage. So not only is it important now for early detection, but it's actually important for the diagnosis, because these patients that have more advanced disease, you're going to probably be seeing in your chair, because we're actually converting them into survivors. So again, I'm not here for you to remember the names of the drugs, but I just want to show that 2011, 2 drugs approved, 2013, 2014, drugs that have actual benefit to the patients with the worst acting melanoma. 2 other new drugs, but the most exciting thing is that we've now been able to put 2 of these drugs together. These 2 drugs in combination for people with the worst possible prognosis have response rates now in excess of 50%. We've never seen that before. We used to tell people they had median survival of about 6 months. So it's really exciting for us in the melanoma field, and so that's why not only is early detection really important, but now we actually have drugs, and so your clients may be coming back to you telling you about some novel therapies or new therapies, and I just wanted you to be aware that things have been rapidly changing in the last 5 years. So with that, I'm going to conclude and let you guys ask questions with Kristen moderating again. Thank you.
Excellent. Thank you so much to all of you. This is so amazing. So I do want to remind you that you can connect with us to ask questions, and we invite you to do that. So let me get that up for you in just a moment. And so remembering that even if you don't have Pull Everywhere but you want to ask a question, you can call 919-445-1000. You can call that number or you can text it, and someone will be there to get the questions into the studio, as well as texting 22333, UNCCN to 22333 in order to get your questions to us. So we have that available, and we will look for your questions to come in. So we have that screen up, and you'll be able to see that as the questions come in, you'll be able to see them as well. So we're still waiting. So I always like to ask questions a little bit, but I do want to ask Dr. Alila to say something that he said on Friday when we did a lecture together. So the common phrase is bronze is beautiful. And I would like for you to tell Dr. Alila to tell you what his version of that is.
Right. So, and I guess this would have been a nice spot when I was talking about the tanning beds, but instead of bronze is beautiful, pale is beautiful. So if you actually come to my clinic with a sunburn or peeling skin or brown skin, we're doing our best to convert you to realize that that is damaged skin. And so we want you to embrace that pale is beautiful, and there's lots of ways that you can protect your skin. I'll never say to someone, I don't want you to go outside and do things, because then I'd be a hypocrite if someone sees me climbing Mount Mitchell outside. There are ways to protect your skin. There's SPF clothing, there are hats, there are sunglasses with UV protection, as well as all of the myriad of products that you can use to protect your skin with a topical. So pale is beautiful was the sentence that Kristen wanted me to say.
It was, mostly because I am very pale, so I support this concept. So I'm wondering if it does come to prevention, and you've had this conversation with a client talking about the ability to do a little bit of a check, and then they open the door to talk about prevention. There's always a conversation about the level of SPF. What is a good baseline SPF that people should maybe embrace?
Well, I think that it should be, we normally recommend around an SPF of 30 or higher with broad spectrum coverage. And so the reality is a lot of people put the sunscreen on thinner. When they put it on, they don't put as much as what it was done to do the testing. So I would say that even if people are putting a 30 on, they might be putting it on in a way that they're really getting a 15. So I think having some higher level sunscreen is good, because then you don't have to worry about how much exactly you put on. I would also say that the sun protective clothing is extremely useful. It's called UPF. So you could buy a shirt that's rated UPF 50, which means that the sun really doesn't get through it. And usually these are tighter weave and they've been tested. And it's really useful because then you don't even have to put sunscreen underneath that shirt. So it's good for people that have a kind of lifestyle. Maybe they want to run outside and do some gardening or do something. They can throw that on and they can be protected, and then just put the sunscreen, on the back of their hands or wherever, their face, wherever isn't covered. Hats are extremely useful, especially having a little bit wider brim, like a 4-inch brim or wider, so that you're not getting the sun on your face and neck as much. Ball caps help with the mid part of the face, but they're still, the sides are still going to get a lot of sun damage if you just wear a ball cap. The other main thing is to try to control a little bit the time of day you go out. If you take your kids to the pool, instead of taking them at noon, take them later in the day or earlier in the morning, or if you're going to do something yourself, you just time it a little bit so that you're not out in the most intense sun exposure times. So those are the main things.
I've got a couple of questions for our panel here. Everything from, are waterproof sunscreens better than non-waterproof? Are spray sunscreens better than non-spray sunscreens? Let's start there.
Well, I think they've gotten away from waterproof because the feeling is nothing's really waterproof, so they're all labeled water resistant now. And yes, so that is helpful because it's resistant to being washed off, versus some moisturizers and things with sunscreen that aren't water resistant. So yes, if you're going to be sweating or swimming, those things are good. I mean, if you're going to work and you're putting on a moisturizer with sunscreen and you might just be walking outside at lunch, for a few minutes, that I wouldn't worry about necessarily needing something water resistant. But if you're going to be out for a more prolonged time, yes, a water resistant sunscreen is best. And then as far as the kind of sunscreen goes, there's the ones that are more like minerals, that are the chemical free ones and they reflect the light, and then there's the ones that are that are chemicals that absorb it and do away from your skin. So I think there can be the advantages and disadvantages of both. For people who have sensitive skin, the chemical free ones are good, because people are not really allergic to the mineral. You can't be allergic to the minerals, which are the zinc oxide and the titanium dioxide, and so those are a couple of things. Now, as far as spray-ons versus the ones you put on, I think we typically feel people get better coverage with the ones you put on versus spray-on. But it's not to say that in some circumstances, sometimes it's very hard, and if you have kids and they're running around and the best you can do is get a spray-on sunscreen on them, then by all means do what you have to do versus nothing, so because sometimes it's just a practical thing. The spray-ons, are a little bit easier to spray on once you have sand on your skin and things like that. So, I think you just have to do what works for you, and whether it's sun-protecting clothing or one kind of sunscreen versus another. And so I wouldn't want to make it too, restricted.
Yeah.
Excellent. Thank you so much. And that actually speaks to one of the questions that came in asking, is spray sunscreen as effective as lotion? So I think you just answered that. And one of our first questions that came in asks, are fair skin or light hair people more susceptible to scalp melanoma, as is commonly thought of their visible skin?
Yeah, I can take that question. Yeah, so people who are fair definitely are at increased risk of skin cancer, in all types of skin cancer. As far as scalp melanoma, I don't know that anybody's ever broken it down, scalp alone versus everything else. But the head and neck melanomas do tend to be a little bit more related to chronic sun exposure. So versus some of the melanomas that occur in the body are more related to having a lot of moles. So there are kind of two different types of melanoma or more. One being the kind that comes from moles, and the strongest risk factor for that is lots of moles. People that have 100 moles, or even 25 moles, they're at about 10-fold increased risk of skin cancer, of melanoma, and that's a very strong risk factor. People who have increased sun exposure, red hair, fair skin, any of those things, for each one, it's maybe a 2-fold increased risk, but that's still significant. And so yes, people that are fair are more likely to get skin cancer, and so those people, would be ones that I think it would be a good idea to really take a look at their face and their scalp. And especially people who've had, and then people can get melanoma who have not had a lot of sun exposure, but then there are the people that have chronic, lots and lots of sun exposure, and those people have a lot of risk for some of those, what we call lentigo malignant melanomas, that the ones that are kind of more flat and grow on some of the ones that I showed in the pictures.
Excellent. Thank you so much. And so our next question, would you speak to the safety of the products used in spray tanning? So as an alternative to being out in the sun, are there warnings or things that people should be concerned about?
I think that most people feel that the spray tans are safe, but it's a chemical reaction in the dead layer of the stratum corneum of the skin. They don't really, it's not doing something to your live cells. So and that's why your stratum corneum sheds every few weeks. So that's why they have to be redone. But I think people feel that that's safer than being out in the sun. It does bring up this question. I get a lot of questions about vitamin D, because some people say, well, I need to go out in the sun to get my vitamin D, and I think we have to be aware of that issue, that the sun has good things and bad things, and one good thing is it does help you make vitamin D, but you can get that from taking a multivitamin or a vitamin D supplement. So it's sort of a trade-off. Yes, you can get your vitamin D from the sun, but also get sun damage, which will lead to skin aging and perhaps skin cancer. Or you can get your vitamin D from a vitamin or a supplement. So most of the patients we see get their vitamin D from a supplement, and they can certainly get adequate amounts that way.
Excellent. Thank you so much. And we have another question. Is there a benefit to the Helioplex type of sunscreen? I was told it does not break down in UV light like some of the other chemicals. So is there a benefit to that?
Well, it may last. It may last longer in the sun. I think that some of it's a practical thing, because some people just tolerate certain sunscreens better, and I think also the physical blockers. I think a lot of dermatologists use the physical blockers because they don't break down in the sun either. They reflect the light, and so we feel that a lot of times that's what we prefer. But yes, the helioplex does have that advantage of lasting longer in the sun.
Excellent, thank you. And our next question says, I am African American and use all different kinds of sunblock, but still get tan lines. Why is that?
Well, I think that's another thing is that sunscreens aren't perfect. That's the light gets through them to some extent. So I don't think you can entirely rely on them. So I think people who are really out a lot, especially people who do boating or that, our sun in North Carolina is extremely intense, and so if you're going to be out a lot, I think the sun protective clothing is better because I could put, a 50 sunscreen here and a 50 shirt that cuts right here, and I can see the tan line because I know that the sun is getting through the sunscreen. So I just think you have to be aware that for whatever reason, it's a 50 in the clothing does better than a 50 with a sunscreen. So, and it doesn't matter what brand or anything. So some sun gets through it, and if you're going to be if you're going to have intense exposure, I would, use multiple things, protective clothing. And it doesn't mean you necessarily have to go out and buy a bunch of protective clothing. I mean, if you look at the weave and you hold it up and it's a tight weave and, and all that, it's probably not going to get through that clothing. But it's just the sun, if you do a specific activity where you're going to be out, it's nice to have one thing where it's not going to get through. But so it's a kind of a combination of things, to get a more complete protection.
Okay, excellent. Thank you very much. So we will wait for a few more questions from the audience. So please send those in. And I think Andrea would like to ask one other thing.
I have a question about, does it take getting a sunburn to have potential skin cancer? Is it just sun exposure in general?
Right, so it's back to what Nancy was talking about. There's these people that literally on their back have over 100 moles. We know that those people statistically have a higher chance of developing a skin cancer. So it's not just your predisposition, but it's also, and it's not just your environment. You may have been just cast a lot with your profile from a genetic standpoint that predisposes you. So you do not need to.
So for those who don't have moles, who, I'll speak for myself, who, I'm a darker skinned Mediterranean type, individual. Does it take me getting multiple sunburns over my lifetime to increase my potential for skin cancer? Or could I have never gone in the sun at all and still have the same risk as somebody else who's a fair skinned person but has no moles?
So, the Italians have two different,
northern.
Doesn't matter. You can be a northern Italian and you can get melanoma. You can be a southern Italian, you can still get melanoma. You can be a Greek. As much as we really want to say that this tends to be a fair-skinned, Northern European descent, it's not. And that's why I think hopefully people have heard the message that, the ethnically diverse salons need to be able to talk to their Asian Americans or African Americans just as much as they need to look at the, clearly Northern European descent type individual. This transcends where you came from.
Yeah, I think it comes down to the fact that the risk factors are complicated enough, and that you're layering on risk factors, of course, with sunburns and chronic exposure, and then it's not, and we all always talk about childhood. I mean, the sunburns in childhood are particularly bad for a stronger risk factor, but it's really the sun exposure throughout your life. I mean, they've shown that if you separate it out based on when you got the exposure, it's not like it's over. I got my exposure in childhood. It's too late. What I do now doesn't matter. It does matter. So it's all it's a cumulative process of damage. But they're so complicated, and there's also a lot of genetic factors too. So while the incidence of melanoma might be lower in some populations, it's very hard for us to predict on an individual basis, for one person what it might be, because that person may have, there's also very subtle genetic differences, what things that aren't like bad mutations or anything, but subtle differences that increase your number of moles, your hair color, your eye color, and also other things that don't change the skin color or the eye color that increase your risk of melanoma. And those people may have some of those things. So we can't, we can't, without doing some extensive testing in somebody, you can't just look at somebody and predict their risk. I think that's what it comes down to.
Excellent. Thank you so much. And we are a little bit past time, but we have one more question that came in that I would ask for you to answer first before we go. The last question, how long will the benefits of sun protective clothing last, and through how many launderings or washings? So if I'm wearing a protective shirt outside, is that all day long, and then does that shirt last long, or is it going to be something that I need to buy more often?
I don't know. There's no expiration date on them, so it's kind of hard for me to say. But I think they last a fair amount. It's probably better maybe just to. Most of them are made of a kind of cloth that dries quickly, so maybe it's better not to put them in the dryer and just to let them air dry. Maybe they'll last longer. But I think if you start noticing you're getting tan through it, then probably need to replace it.
So, Kristen, I would just like to say that for those of you on the web exchange, the woman who is off camera that you haven't seen or heard from is Jean Sellers, and she did a marvelous job in putting together this so that we could reach all of you today. So I'd like to give a shout out to Jean Sellers. Thank you very much.
Thank you.
Absolutely. Thank you so much, Jean. And thank you to all of you for sharing your expertise with our audience. I hope that you found this useful. Thank you very, very much for your questions and for being here. Check us out at unccn.org, and we will see you next time. Thank you.